Okay, ready whenever you are, Fred. Good evening. I'd like to call the Board of Health meeting to order at 4:41 p.m. If everyone could please rise for the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay. So up first on our agenda, we have Olivia Antonsen. Hopefully I got that close.
Close enough.
She is the intern here, and she has provided us with a wonderful rate study. And I'll introduce you. This is Roberta Johnson.
Hi. Hello.
You know who I am. And this is Lori Duchamp, my other
Hello.
member. And then that's Camille, which I know you've worked with on this. So, okay, so I'll turn it over to you.
Okay, awesome. So yeah, Jen introduced me, so I'm not going to reintroduce myself. But what I've done here is I've looked at the Board of Health's fee schedule, and I've gone through and I discussed with Camille what she thought would be good additions or changes, and I also compared our current fee schedule to local towns of Webster, Oxford, Charlton, and Sturbridge to kind of see where Dudley ranks among our prices, if we're like outpricing ourselves, if we're coming in under the industry average. So after going through this report, I've come up with, I believe it is 22 recommended changes here, 22 proposals, 19 additions, and 3 changes. So I've organized them out by category as it's listed in our current fee schedule. So like with food and beverage service, I'm not going to list out all 22 because I think that would be kind of a waste of time. But we can see here that we have like plan reviews, adding them on here. And then also the prices. A lot of these prices are modeled after Webster just because Webster is very similar to Dudley's, so that's where we got a lot of our pricing info for our additions. Like here with plan reviews, we can see that that's just a way for businesses to be more in compliance before construction begins, so plan reviews kind of just make sense to be additions. It's not a way to kind of get extra money, it's a way for compliance to be ensured. We can see we've also added a change here to septic. With septic, this one's a little different. The fee already exists within the fee schedule, but it's just not listed on the updated copy as of 10/6/2018. So this is just kind of adding it on where it already exists. It's just not listed. And if we move on to swimming pool, there is 1 proposed change and 2 proposed additions to the swimming pool fee schedule. With tanning, there's 1 proposed addition. Body art has 1 proposed addition. Nail salon is an addition. Housing is 1 proposed change. It's just renamed from Chapter 707 Housing Inspection to better reflect the service provided. And finally, with marijuana, this is a completely new section, mostly modeled off of what Webster has done, just because marijuana is an expanding industry in Dudley. So we can see here the 8 adult use marijuana fees are all new, and then the medical ones as well. Those 2 are new here. Then after going through all of those recommended changes and additions, I do have a quick section on revenue and expenses. We can see here that the revenue's kind of been in a steady decline since fiscal year 18. I know those numbers are a little fuzzy on the graphs, but it does go from fiscal year 16 to fiscal year 21. And then we can see our expenses have also been clearly rising since fiscal year 16. And I do want to make a note here that not all of the expenses are going to be accounted for because there are some expenses recently that were billed to either the CARES Act or ARPA funding, which is the American Rescue Plan Act. So it's just not an accurate representation of expenses, but clearly enough it has been rising even without those ARPA and CARES Act expenses. Then we pretty much move on to my conclusion, which is pretty much restating everything I've mentioned in the report, the 19 additions, 3 changes. Most of those additions I think are plan reviews. And what would we do with more revenue to the Board of Health? That's the big question here. So the Board of Health gives back to the community in a lot of ways. I think primarily there's the Earth Day event, there's the bike rodeo, we even do the vaccine clinics like we're having this weekend. So more revenue just could be used to offset expenses incurred by the department and allow the Board of Health to give back to the community in a greater capacity. Increased revenue could also be allocated towards more hours for the health inspector. It's currently about a 10-hour per week position, and other towns have more than 10 hours a week, and it could be anticipated that Dudley would need to increase those hours to keep up with the demand here, so that's just something to consider. Let's see. So events like the flu clinic, the bike rodeo, and Earth Day are 3 examples of how the Board of Health supports the Dudley community. Expenses incurred during the Earth Day cleanup event include buying trash bags, gloves, water bottles, snacks, and seedlings for volunteers. Years past, the Board of Health has also provided t-shirts and ice cream to volunteers, so an increase in revenue to the health department could be used to improve community events like Earth Day by just providing more funding for resources and covering rising expenses, making Earth Day an even bigger and better event, and giving back more to the volunteers who volunteer their time to clean up our town. Then at the end, I do have appendices, Appendix A, B, and C. Appendix A lists the changes and additions to the fee schedule as discussed in this report. Appendix B provides a comparison of those changes with the 4 local towns where applicable. And Appendix C is a representation of the new fee schedule if all the proposed changes and additions are adopted. And you can also see that in Appendix C, anything highlighted in yellow is one of my 22 proposed additions or changes, just so you can clearly see compared to what we currently have. So, totally open to questions.
Okay, thank you. I'm going to start with Camille first off, because I know you worked with her. What do you think of this?
I think that I think the fee schedule wasn't horrible to start off with, but I think that the 22 changes that Olivia made are definitely necessary. I definitely agree that being able to support more of the community events as well as possibly increasing staffing hours is reason to continue pursuing this.
Okay, thank you. Lori, did you have questions?
So in the swimming pool, the additional pools would mean if somebody took down an existing swimming pool and needed to replace it, it would only be the $50 for a second pool.
So I'll actually jump in
Okay.
on that one. So for the swimming pools, it only applies to public and semi-public pools. So if there is an apartment complex or a condominium, it does not apply to the residential, anyone who owns like a single family house or a
So
residential.
non-residents.
Right.
So we currently have a $20 pool review for residential.
Which is under the building department, or is that?
No, it comes to the Board of Health.
Okay.
We just haven't had, I don't think we've had any pools.
I don't know what regulations they would be reviewed under, because the DPH pool regulations are specific to public and semi-public pools. So condos, gyms, apartment complexes.
So this is, it would be a $20 fee when they would, if they're putting in a pool, it would come to the Board of Health to review the location of the pool versus the septic system.
Okay.
And it was a $20 fee. Does that sound?
So that sounds reasonable, especially with such a high prevalence of septic and private wells as
Right.
well. So that makes sense. I don't know if we have that kept in the fee schedule, but we can certainly put that back in if we didn't.
And that's for in-ground or above?
Yep,
Either or.
either or.
Because there are septic requirements, setbacks.
Yeah, I would understand that. And so obviously I'm gonna question the tanning, body arts, and nail salon. If this is and maybe most especially for us in Dudley for the nail salon, because there is a fee, is this in addition to the current fee that we oversee? Because that was a big project of mine to.
So these are typically one time for a new establishment coming in to open up.
Mm-hmm.
That's when the plan review takes place, and then they would so it would typically be you apply for a plan review, you submit your floor plans and make sure everything is that you're proposing is up to code,
Mm-hmm.
and then you have an annual permit thereafter. So this is only a one-time thing.
Okay.
It, pre-existing establishments wouldn't have to do a plan review.
Okay, just curious on that. All right, that was, I think that was about it. Excellent job, by the way.
Thank you.
You laid it out so even this common woman here could easily read through it.
Rose, do you have any questions?
Yeah, so the yellows are for new people coming in, right? Is that what I understand?
The plan reviews,
Yeah,
yes.
a new person wanting to come in town to open up something, so that's what these yellows are?
Yep.
Okay.
So for frozen dessert, we do have retail and manufacturer. Those are a little bit different. Those are actual both annual recurring permits. Those are required through the state that the local boards of health issue those out. The retail is pretty much if you have a soft serve machine, that would be a retail. And then if you are actually manufacturing or making the product that then goes into the soft serve machine, or making any hard serve ice cream. And both of those require monthly lab reports as well.
Okay. Excellent job. I'm really, really happy to see the marijuana, because I know that's something that we hadn't gotten to, and so I think that's very important to have. So I guess we would have to vote on this to.
How do we want to word it?
On the
Accept
22
the-
changes?
Okay.
Can we lump it into one? No.
Yes.
Oh, my heavens. All right, how do we word this?
I guess just per the front page, just including all of the proposed changes or 2, 3, 4, 5, 6, 7, 8, 9, 10. Are there 10
There's
areas or more than that?
There's
Food
22
and beverage, septic,
22
swimming pool,
proposals.
22 proposals, and there's 8 fee categories.
19 additions and 3 changes.
My heavens.
So 22 proposals, 8 categories. Will that be sufficient?
I
19
would entertain
changes.
that you would, you know, to the
Except the
proposal that Olivia presented regarding the rate study, with the 22 proposals of the 8 different subjects, 19 of them additions, 3 changes, as noted in the rate study. Something to that effect.
Thank you.
It's
Agreed?
what I would entertain.
Yep. So entertained?
Yes. Yes.
You have to
wanna word
make-
it?
Okay.
Somebody
All right.
has to make it.
So, let's see, I make a motion to
Except,
accept the 22 proposals with 19 additions and 3 changes as, what did you say, as written for the
Present.
Board of Health fee schedule? I missed that middle part.
As presented.
As presented, on the Board of Health fee schedule? I didn't write any of it down. I'm sorry. Tell me that wording again. Sorry, my mind is just not here today. I apologize. Proposed
make-
changes and additions
Right.
prepared for the Board of Health.
22
Okay.
proposals, 8 categories, 19 additions, 3 changes, as written by Olivia. Our proposal for the rate study changes.
So I have a motion.
Yes.
Do I have a second?
I second.
I have a motion and a second. Any other discussion regarding that, lovely?
Don't leave it up to me. I don't.
Okay.
I have no other.
Seeing none, all in
Aye.
favor?
Aye.
Aye. Passes unanimously, so this will take effect as of today. Olivia, thank you so much for all your hard work. This
That
is
was good.
wonderful.
Thank you.
Thank you.
Appreciate it, and we'll call on you if we need anything else.
Okay, awesome. Thank you.
Thanks.
Wonderful.
Have a good one.
You too.
You too. So up next is the discussion on the DESI mask regulation, so this was originally supposed to be lifted on January 15th, but some new information has come down, and now it's February
28th, I believe.
28th.
I believe, yeah.
So,
Or 28th.
DESI is not lifting, and they're now pushed it off till February 28th, and they'll review it, I'm sure, as they go, as needed.
Mhm.
So anything else to add on that? Did I miss anything?
I don't think so.
Okay.
No.
Up next, discussion regarding the vaccine clinic on January 15th. So we are holding a vaccine clinic here at the town hall between 8 and 12 on January 15th. The link is on our Facebook page, on the website. You can sign up for it. It's for first dose, second dose, or boosters, and it's for, I'm gonna let you do the ages because I'm not gonna get them right.
5 to 11, first dose 5 to 11, second dose 5 to 11, boosters 12 and up.
And first and second doses for any adults that may need them. So you can sign up right on, there's a link right on Facebook and the website. sign up. We'll be here. We've gotten a lot of good response to it. We have a good amount of people.
I've been sharing it and telling people.
Yeah, Webster shared it, so.
Yeah, we're very excited.
Yeah.
Very excited. I think
I'm
it's,
sorry, I'm gonna miss helping out.
I think it's gonna go very well.
Good.
We've gone through things and it's gonna go well, and
Yeah,
we're just gonna roll with the punches, right?
right.
It'll be
Yeah.
good. Do you have anything else on the clinic?
No.
Nothing?
No, no.
It'll run just as smoothly as the first two we did, so you guys are gonna rock it.
Yeah, right, so the first two, that reminded me, anyone who's signed up for a first dose, they're gonna get a link, like a couple days after, that's gonna automatically, bring them to the February 5th date, so they can sign up
February
then.
5th is the
Right.
second dose
So-
if you're getting the first
Yeah,
dose.
so we'll be doing another clinic on that,
Right.
that date,
Yeah.
so that will be very
I
good.
haven't looked into the walk-in, with the QR code.
Okay.
We were a little late with the time for the training, so I didn't hear that part, so I don't know if we wanna revisit that.
Did
for
you get the
second.
video of the training? Cause I know she sent it out.
I got a link to it. I haven't actually
haven't
watched the
watched it.
training
Yeah.
video yet.
So, I mean, we'll still have plenty of vaccines moving forward, so if we wanted to do a day where we do walk-ins, or, there's been a lot of
Like a
people that-
pop-up walk-in clinic
Right.
almost.
A lot of people that have been COVID positive were due for their COVID booster, and then they can't. So, that would be an option to think of down the road. We could continue to advertise that we have them, and if people wanna pop in,
Right.
they can still get their booster, so.
Oh, I think it's gonna be good. I think we're ready. I'm glad we get to do this for the town.
I don't think it's
Very.
gonna snow Saturday.
I don't believe I've heard anything, so
good
that's a good
weather.
thing. And I'm glad we get to bring this out and put it out in the
Right,
town and
yeah,
the community
same.
that
Mhm.
we need, so.
Yep.
The other item that's listed there is the home test kits. So we've been inundated with phone calls as to when is Dudley going to be handing out their test kits. So let's back up a little bit. The state did give out free test kits to some of the towns. Southbridge and Webster, the surrounding towns, were able to get the free test kits. Dudley did not qualify for the free test kits, so we did not get any test kits to hand out. So that is why you haven't heard anything, or there's been no information about it.
Right.
We haven't gotten them. I'll turn it over to you so you can explain what hopefully will be happening.
Right, so, was it 7 communities or 6? 6 or 7 communities that are gonna try to pool, their resources together. There's a grant to see if we can purchase them in a bulk amount. So we're in the process of doing that. So, but these things take time. It's just not like, going to the store and picking them up. So they take time. And then there's gonna be a central location, I believe, Leicester or
So-
something, for us to go pick them up, so.
Right, so my understanding is that originally we had a couple of, 7 or 8 communities that were just gonna kind of pool our resources. Information kind of was updated since then, that the Central Mass Regional Planning Commission is kind of spearheading it, and they are an authorized entity to purchase on behalf of several communities, so it's more than just the grant funded communities. So right now, we are letting the Central Mass Regional Planning Commission kind of take it and run with it. So as of right now, they have some deadlines for local municipalities to get, paperwork over to them for contracts, or proposed agreements. They will be ordering it on everybody's behalf. They will have one central pickup location for each municipality to then gather,
Yep.
What's allocated for their residents. And then who the local municipality distributes to is each,
Right.
we'll have to figure that out for Dudley's distribution process.
Absolutely. And we will notify people when we do get them. It will be publicized, so we appreciate everyone's concern, but we're at the mercy right now of waiting. So, and
Right.
as soon as we get them, we will, and we're gonna come up with a method to distribute them. Because again, we don't know how many we're getting, we don't know any of that information, so it's all gonna be doing everything on the fly, but we will notify, and, you know, it'll be posted on the Facebook, on the website, everything, and there definitely will be notification about it prior to. It won't just be, oh, here you go. There'll definitely be notification, so just to put everybody at ease, and we're doing the best we can.
Right. Yeah,
And again, those will be, you know, the state isn't giving out any more free test kits right now to any communities, and we did not qualify, so.
Yeah, I don't think they're giving out any more. That's
No.
it. They're done.
That's it, yeah.
So we're trying, we're working on it.
Absolutely. So, item number 4, COVID protocols. So I'm gonna turn it over to our public health nurse so she can tell us what's been going on with COVID in the community and what protocols.
So with the guidance changes,
Yes, please.
so the CDC and the DPH changed their guidance, protocols for isolation dates and quarantine changed too, and so didn't the guidance for vaccinated individuals, because prior to, I believe it was December 27th, if you were fully vaccinated, you didn't have to quarantine. You weren't considered a contact. So now that changed. If you're vaccinated greater than 6 months with your second dose, then you have to quarantine for 5 days and test. If you're vaccinated within the 6 months, fully boosted, you don't. So that was a big change, because, you know, just 3 weeks ago, you didn't have to, and now it's back to that. If you're COVID positive, it's still a 10-day infectious window, but the CDC DPH changed it from 10 to 5. On day 5, on day 5, if you have no fever, you have no symptoms that are preventing you from going to work, you can be released on day 6, but you must continue to wear your mask for the remainder of the 5 days. Quarantined individuals, if they had a contact with somebody, they would have to quarantine for the 5 days, released on day 6. School's a little bit different. I think they don't require the students to get tested. They have to quarantine, but they don't have to test. And adults don't have to test either. It's not mandatory. It's best practice to get tested. So there's, you know, and daycares have a different guidance too. So there's like 3 entities there that, you know, the general public, the daycares, and the schools, they're all just so different.
And then if you're a healthcare worker,
You can go back.
you can go
and
right
don't
back
have-
to work.
But, you know, the infectious period is still there. So, like, you know, in my discussions with a lot of people, it's like, you know, the 10 days are still the 10 days, and you might not feel better in 5 days. So if you need 6 days or 7 days, you know, so it's just, it's been a little bit hard. But, you know, we've had quite the surge in town. We've had a lot of cases. I mean, at one point I was up to in the 150s, and that's a lot for our town. And I think we're still teetering between 120s and 130s. You know, so we had some discussions about, you know, the spacing, as you can see with the surge. You know, even people who are fully vaccinated are getting the virus. So that's why we thought, why don't we be a little proactive, space out a little bit. If you want to wear your mask, you can. We're not making anything mandatory. We're not going back to the ways we were we had plexiglass between, and we spaced out, and we wore masks, appointment only. We're not talking about going back to anything like that, but, you know, the hand washing, the social distancing,
The reminder
the
that.
reminder to it's still there, and to do the best that you can.
And if you don't feel good,
Please don't come to work.
please.
Because this new variant presents as a cold, you know, upper respiratory, runny nose, sneezing, congestion, it's all upper. So, you know, that's what we're trying to remind people to, if you have those symptoms, to stay home and get tested.
Right. And it is difficult to schedule a test, there's no
Yeah.
doubt. I had to, and it took me hours, and it was just basically going from site to site to site to site, back and back and back and back. And then finally, somebody must have canceled, and
one
we were
popped
able
up.
to get an appointment.
Yeah.
It's really difficult, and we don't have any ins. You know.
I spend the same amount of time that anyone would, you know, going through them all.
I
but-
texted you to say, should I
Yeah.
try here, 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 and here? And, you know,
Yes,
just
yes,
to,
yes, yes, and
yep,
yes.
and just kept going. And finally, at like 4:30 in the morning, I found this empty spot. So it's difficult. We understand that, you know, but it's just the way that it is right now.
Sure.
Do you want to talk about anything else? We'll just.
I don't think so. I think, you know, I did the talked about the cases in the schools and, nothing really, the clinic's coming up, so I think we touched it all. No? Yes?
think
I
so.
think so, yeah.
I think so. And again, if anybody has questions or concerns, they can call the Board of Health office, by all means, and they get a message to whether it needs to go to Roe or Camille or whomever, they'll get the information there. Okay, up next, health agent report, comments.
So it's been a while since our last meeting, and I
Yes.
feel like there was a lot of holidays and illnesses scattered in
gosh,
there. So I'm trying to jog my memory a little bit. The Shepherd Hill Craft Fair, which was back in November before Thanksgiving, which
Oh my
feels like
gosh.
years ago.
Yes.
It went very well. I don't know off the top of my head how many vendors we had. I want to say it was about 20 or so, 15 to 20
so.
vendors. There were no issues, so that event went really well. We did have one new restaurant open, which took up a lot of the time of doing a plan review process, making sure they were into compliance before giving them their permit. They were given the okay to, start ordering food and bringing in full operation as of December 23rd.
Very good. Great, thank you. Any comments or anything about COVID or anything else that you want to add? No?
No,
You're
no.
done
Yeah.
with COVID?
I'm not done with COVID.
Okay.
Is it gone?
So up next would be the approval of the minutes from the November 9th meeting.
Oh, my.
I make a motion to approve the minutes from the November 9th, 2021 meeting.
I second that.
I have a motion and a second. Any other discussion? Seeing none, all in favor?
Aye.
Passes unanimously. Up next is the approval of the 2022 meeting schedule, which I do not have, and Amanda is out. I apologize. I totally forgot we were gonna need that. So we're just gonna
We'll
push
table
that
it.
off, but I will, we are looking at the next meeting date, while we're right here, of February 8th, because on the third Tuesday, there's a conflict, so how does February 8th look to you?
Let me just take a quick look. I could do this, it'd be about 4:40 for me again.
Okay.
Same time, so.
Works for me.
So the next meeting will be on February 8th, and that's good, we'll be able to follow up from both clinics.
Right.
And again, if we needed something, and then I'll have Amanda do this next schedule for the next meeting, since I got it. Okay, any public or board comments? There's no public, everyone's left us, so any board comments?
No, none for me.
No, I am good.
Okay, basically, I just wanna remind people that we are the Board of Health, we oversee many different things, and we are volunteers. We are not here 24/7, 7 days a week. Yes, we have a health agent, she also does the town of Webster.
Right.
Which is doing fabulous, by the way, I have not one complaint. Yes, we do have a public health nurse, but we are volunteers, we put in our time, and there's a lot of working things going on, and we're trying to do the best that we can with what we have. I have, our clerk covers 3 offices, and she does a great job for us. So it's just, I just want people to bear with us, and I know everybody expects us to give answers and have everything and be on top of everything right away, but it doesn't always work that way. And we have limitations with what we can do. You know, just because we are the Board of Health doesn't mean that we can contact a restaurant in a different town and, you know, things like that. Yes, we try to follow up on things, we try to go through everything, but sometimes you have to weed through it all. So I appreciate all the patience and everyone, and again, we have the link to the state is it the dashboard that tells how many cases and everything? That's always up on the website. There's always the information. The state posts the informations constantly. We do not get our numbers out every week because they're constantly changing, but the state does for us, and it's just one less thing if we link them to the state. And that's where any information can be found is mass.gov. There, you know, any information we follow, it comes down from the DPH.
Right.
We don't go above, beyond, less, you know, we do what they say, that's what we're doing. So I appreciate everybody during this time. We're trying to do the best we can.
That's right.
So, and
Amen.
they get burnt out. And, you know, my health agent is not 24/7, 7 days a week devoted to this town. The public health nurse is not 24/7. There are still lives that go on as well. We're trying. So we're doing the best we can, by all means. And we hope you understand that and appreciate it. Anything else? If not,
I make a motion
make
to
a
adjourn.
I've got a motion and a second. Any discussion on that?
No.
Seeing none, all in favor?
Aye.
Aye. Meeting adjourned at 5:12 p.m. Thank you.